Welcome to the PEHRI TechCast. We'll bring you all things science, engineering, technology, and innovation. Today we are joined by Eric Klos, founder and CEO of Delibrate, a cloud-based software as a service company delivering personalized environmental insights for better health outcomes. Deliberate is an environmental health intelligence and wellness platform leveraging a mobile app available via the Google Play and Apple App Stores that helps people to track symptoms, pinpoint their triggers, and reduce potential health impact. So, Eric, welcome to the show.
Thank you very much, Ezekiel. I really appreciate this opportunity to talk about Daily Breath.
All right, so let's dive in. So, firstly, tell us about your health tech app, Deliberate.
Sure. So Daily Breath was inspired about 8 or 9 years ago by an understanding that environmental determinants of health had really been neglected by the medical community, and it was inspired by a kind of a light bulb moment. My sister has rheumatoid arthritis, and she was living with me, my family at the time. And she came down with, a flare up, which means her hands were gnarled and rigid. And she said, it'd be interesting to have a weather app that would tell me when my RA is going to flare up. And it kind of just struck me, health, weather, those kinds of things. And so I started looking at environment and realized that respiratory health was significantly impacted by the environment, cardiovascular health, migraines and headaches, arthritis and joint pain. But I started to look at, some of the negative health outcomes associated with respiratory distress, right? When people have asthma attacks is a euphemism for respiratory distress. And that means they're having difficulty breathing. And so it struck me that there were a lot of ER visits, a lot of hospital stays, and even people dying from asthma attacks, right? And so I began to focus on respiratory distress. Um, and so that's kind of why I started to build some MVPs. And then I went to market in 2020 with Daily Breath on both platforms and, have generated some growth, but certainly, need to accelerate the growth. A lot of that we can get into as far as some of the technical challenges that I've encountered as I tried to connect kind of environmental data with the health app and how to communicate that information to users, to people who are trying to understand what are they experiencing, right? And I look forward to kind of getting into some of the specifics around what those technical challenges are and how science can really respond to that.
Interesting. So, in simple terms, uh, tell us how does the app take air quality data and make it personal for each user?
Sure, and that was one of the key variables when I started it. One of the slogans I use is called "Personalizing Public Health." Most often, what people do when they're looking for air quality is they look at weather reports, and there's an air quality index, and then there's sometimes some pollutant measurements. Now, unfortunately, those measurements are not very granular. Okay. And when I say granular, they're not really personal. Okay. Most of the air quality data that you're consuming is either from satellite observations or they're from fixed network sensors that are distributed very broadly. And so that's not very granular information. It's 5 kilometer or 3.1 mile radius information. So imagine if you are in your location, when you read the air quality index for your location, that's really encompassing a 3.1 mile radius from your location, or 5 kilometers, right? So that's not very personal data, right? So that's the real challenge. Now, having said that, you have to don't let the perfect be the enemy of the good. Use the data that's available, right? And so, certainly I use that data, but the idea was, okay, we're not just looking at the severity of pollutants. We're actually looking at how do we experience that, those pollutants, right? So what I wanted to do was build a platform, and specifically with the app, an ability for the user to track their symptoms, and then on the back end associate that with whatever weather and environmental data is available, right? Because ultimately you want to understand, well, what types of levels of measurement for various pollutants are causing me to have my asthma attacks, right? It's not just an issue of how severe the exposure is, but how does my body physiologically respond to those pollutants, right? So that ultimately is what I call personalized environmental health, right? We have our own genetics, right? That's personal, right? Well, how we experience the exposures is personal as well. So that's what I was really trying to do, was create that model. And then, like I said, I think one of the technical challenges as I did that was recognizing this lack of granular data. And what we have seen over the last 8 or 9 years that I've been doing this is the emergence of better means of generating this data. So one example is they've now started to put these air quality sensors on vehicles. It's called, mobility-based air quality sensors, right? And so there's a couple of companies out there that are doing that. And that gives you much more, almost, 20-meter level data, right? So much more granular. What's very interesting about that approach too is in urban locations, it can be mapping roads and the air quality on the roads and stuff like that. So the conversations I'm having with that type of a company is to say, hey, listen, maybe we can actually create better routes for walking or for running or for driving within the city based on how bad the pollution is in a particular location. And then the other thing that's emerged are these wearables, and even some wearable air quality sensors have started to emerge, which is really great because then we're really measuring what is the person actually experiencing in their immediate environment. What are they breathing in, right, directly into their lungs that's problematic, right? That's really personal. And so what we're doing with that is we're tracking those symptoms, associated them with those specific variables, and then on the back end, we're applying AI and machine learning to actually refine that into your own personalized risk index, as well as your own personalized alerts. Let's say you're more sensitive to nitrogen dioxide, which is a kind of a traffic pollutant. Then, maybe when that threshold is a particular level, you suddenly learn through the AI, that you have more symptoms at that level. And then now suddenly we can set up an alert through the technology to actually give you a direct alert when that threshold is reached. So it's really, creating a personalized environmental health model, which is really what I wanted to do to differentiate it from kind of a public health approach to broadcasting information about how bad the air quality is in your area. Because I don't think people respond from an action perspective, changing their behavior, unless they understand that the information that is being delivered to them is personal, right? It's relevant to me, right?
That is wonderful. So, tell us, what was the biggest surprise you found when you started connecting air quality to people's everyday symptoms?
Well, but I would say that there's two things. Again, I would say from the beginning point would be the lack of data, right? I mean, I just presumed when I started the process that, oh, I'd go out and get air quality data. And when I started that originally in the US, EPA Air Now was the local source for air quality. And they only had about 110 sensors across the entire United States, which is a fairly large population. And then what they do is they model the data for this 5 kilometer, 3.1 meter mile gridded data. So that was the first thing. I think we kind of covered that material. I think the second thing was, again, I knew that there were certainly, again, 8 or 9 years ago, there was certainly a lot of evidence. And I had a climate scientist do a literature review of kind of the correlation between weather and environmental variables with specific health conditions. And asthma and allergies were the first one, but I had them do COPD as well. And so at that time, we developed a daily breath risk index based on some of that information. And so we created an initial risk index that said, well, on hot days when there's hot temperatures and high humidity, there's a higher incidence of ER visits for asthma, right? So we suddenly had a correlation for the pollutan's bad, but on specific days when it's hot and humid, your experience of those pollutants can even be more problematic, right? So we started to create that risk index. What's been interesting over the last really 7 or 8 years is that the evidence, the research that's going on around the impacts of pollutants on our health is substantially increased, right? And so we now see that wildfire smoke actually has an impact on pregnant women, on the babies that they're carrying, right? That is causing those children to have asthma in the future, right? And so we're beginning to see a lot more evidence. The other thing that we've learned is PM 2.5 particulates, which are partially wildfire smoke, but there are also various other types of pollutants in an urban area, actually have a direct impact on the frontal part of your brain, right? And so people are beginning to realize that what are the impacts, on people's mental health? What's the impacts on their productivity? That's one of the reasons you're seeing a very strong focus on indoor air quality in schools, because people are beginning to really understand that maybe indoor air pollutants are actually having an impact on how children are learning, right? And so things like that. So I would say what's been really interesting over the last 7 or 8 years is really the research behind that, which you would think would hopefully move the needle, and I think it is beginning to do that in getting people to understand that they're impacted on a personal level by pollutants, and their health is impacted by on a personal level, and that they really need to understand that. They need to be aware about that. They need to really understand, how is it impacting me? And really just looking at air quality information from an index perspective or whatever. If it's passive, it really doesn't provide me the material I need to actually say, okay, you know, these are actionable. These are insights that I can take action on because I know, hey, today's going to be really bad. Maybe today is a day, one example is like wildfire smoke. If you know a wildfire smoke event has occurred and potentially smoke is going to come into your area, you probably need to change your filter. You probably should be changing your filter regularly anyways. But in advance of a wildfire smoke event, you definitely want to change your filter because that filter is going to accumulate more particulates very, very quickly. And if it already hasn't been changed, it's just going to suddenly would not work, which is too problematic for two reasons. A, it's not cleaning the air in your home, but B, it's also potentially threatening the function of the air conditioner that you're using, right? Because the filter's clogged, right? So that's a problem too. But those are kinds of the things that, you want to give people enough actionable insights that they can take what I call upstream interventions, right? If you put an air purifier in your room, then that might help with your air quality and you might not have a symptom or an asthma attack. It's like these are interventions that really stop things from progressing to a bad health outcome. And that's what we're trying to do.
That is interesting. So, tell us, where does AI, machine learning, and data science come into play when discussing what you do and with Delibrate?
Right. So the way AI and machine learning is applied is, we have what I call the Daily Breath repository, data repository. And so what's going on in the back end is you're collecting, we've got lots of demographic information about the user. We have obviously all the weather and environmental data information at the pollutant and allergen level, as well as some of the weather variables. And then we actually have the user when they're tracking a symptom. So the idea would be, I click on record symptoms. I say, whether the symptom was experienced indoors or outdoors. Then I basically say that, these were my symptoms, like I had some wheezing, or I had a little bit of a cough, or, I was sneezing, whatever that symptom is, right? And so you're recording that. You actually record the severity on a scale of 0 to 10. We certainly can ask more information as well in that tab as we progress. But the idea then is on the back end, now I've stamped that information, right? And so what happens is once you start developing enough data, you're making some AI machine learning against the entire database, right? So we hope to be able to come out with a lot of things about, the very stratifications, like 0 to 17 is, children, right? So we'll be able to start, providing some of those findings, saying that, more people experience symptoms on these types of days, right? When the temperatures are this temperature, right? As opposed to the climate research that was done previously, this is going to be real world evidence, right? This is evidence based on people's actual symptoms experience. So that's where the AI and machine learning is applied. On the broader level, and then on the personal level, and this is really a question mark. I mean, how many symptoms for a individual user do we need to track, right? Before we begin to apply some AI and machine learning so that we can get some general specialized information that we can then drive into personalized alerts, right? And I don't know, I think, I think the last time we pulled our data, we had somebody, this is over a 3-year period, had about 25 symptoms that they've tracked in the database, right? We're trying to figure out like what that threshold is. At the end of the day, everyone wants AI immediately, but it has to be grounded, in a certain amount of evidence, right? And so, what is the question of how many symptoms do we use to ultimately drive that? Hey, we've gathered enough evidence that this is a valid AI, ML analyzed risk index that we can project for the user, right? Because again, this is, we want to be scientific based. We want, the risk index that we communicate as a personalized risk index to reflect their personalized experience of these environmental triggers. So that's something that we're just going to be continuing to work on. I don't think it's 25. Quite frankly, I think you need to get to the 50 to 100 range for the number of symptoms tracked. That can be challenging. People with severe asthma probably do over a 3-year period hit, in that range, right? Because when, the issue is like when they use a rescue inhaler, that means they had symptoms, right? So what we're hoping they do is they, record that the symptom, and then they use their inhaler, and then they record the symptom, right? So they get the relief, but that's kind of how it's going to work. And like I said, I think once you have enough evidence, then you can actually say, oh, okay, well, based on all of the data that we tracked, it's actually 84 degrees. If the temperatures are above 84 degrees, then this particular user has had symptoms, right? So maybe higher levels of heat are a trigger for this particular user, right?
That is interesting to know. So tell us, what is the coolest piece of technology that you are using behind the scenes that makes the Delibrate work fine?
Right. Again, I think based on what we're describing here with the personalized risk index. So the DailyBreath risk index as it stands right now is based on studies that were researched, right? And so that's a study-based risk index. what we're trying to drive towards is something I call the PEHRI Score. Okay, it's a personalized environmental health risk index score, and that would be driven by the specific data around your symptoms experience, right? Um, that's where this PEHRI score, I think, becomes unique in the marketplace, because at a glance, you would basically know that this is your personal risk index for today, right? Now, it would also potentially, the back end data that's being collected would also potentially say, hey, your PEHRI risk index is here, but you've actually received an alert because nitrogen dioxide is one of the pollutants that is your predominant trigger, and that's that information as like a predominant trigger is based on the accumulated evidence that's been gathered, in the database, right? And with the AI applied, right? And so we've determined that the user is most impacted by nitrogen dioxide, and they're most impacted on days when it's above 84 degrees, right? And so those variations basically will lead to a personalized risk index, PEHRI score of whatever, 4, 5, whatever. But it may also lead to, hey, that person's going to be notified that, hey, nitrogen dioxide is particularly problematic today. So you might want to be careful about, going into an urban setting, right, where there's a lot of nitrogen dioxide or something like that, right? But that's really the unique part of Daily Breath is we don't have a personalized health model for environmental triggers. What we have right now is a broadcast, or what I call a distributed model, where we tell the mass audience out there that here's how bad the air quality is, right? Well, that's passive information. It doesn't really engage the user, right? And it doesn't provoke them to action. So the component that is key for Daily Breath is giving you more personalized information, and then giving you some ideas about some preventative actions that you can take to potentially mitigate the impact of those triggers. Okay. In a perfect world, we would be enacting clean air initiatives and climate change mitigation policies that would address our clean air. But the reality is we have to deal with the bad air quality that we have every day. And we're not doing that. And our medical system is not doing that, right? My hope is that as we begin to gather this information, we create tables of variables, we create those types of things, and we can have the user share that with their doctor. Say, hey, this is what I'm learning about my triggers, my own personal triggers, right? And so maybe that becomes more of the dialogue with your doctor is, what can I do? Maybe there's, I personally sometimes wonder, are some of the medications that are out there, are they effective, after a period of time when people are exposed to so much pollution, right? And so the question really becomes, okay, is that drug effective? And is there potentially another drug that could be taken that might be more effective? So again, there's just been a disconnect really with this issue of the environmental determinants of health as a component of the healthcare system, right? Not just a matter of public health, but an issue of how do we integrate it into the fabric of how doctors provide care to patients.
Wonderful. So tell us, Eric, what has been the hardest part about turning a complex science problem into a simple mobile app?
Well, and again, I'm on that journey right now, right? So I would say that the hardest thing is, at the end of the day, when you're dealing with two particular components. One's the technology and the development necessarily to develop the mobile app, and that's been a challenge at times. But what's largely the harder part is when you're dealing with a business to consumer market, which is what the app stores are, right? Well, in the case of health, right, there are probably 250 to 300,000 health apps in the stores, right? And how do you communicate your differentiation to that community, to those communities, in a way that gets them to download the app, to pay for the app, to purchase. I have affiliate relationships on the app where you can purchase an air purifier or stuff like that. So, it's going through the traditional models for a mobile app today. Is how do you get people to download the app? How do you get people to utilize the app? How do you get people to pay for the app? How do you get people to do certain behaviors when they're in the app, right? And then ultimately, as we do that, are there business to business opportunities where potentially down the line, this information can be part of the healthcare process, the healthcare delivery process? And that is again another challenge, or to get that to get that communicated out to the market. Some possible ways that can be leveraged for the patient. But I would say that's the biggest challenge is you're trying to implement unique technology around specifically a unique topic, right? When there are so much out there that's focused on other topics, right? And so sometimes I think that's one of the challenges, and to a certain extent, climate change is a driver, and therefore it's complementary and to a certain extent, but it's also somewhat noise. Okay. Same thing when you're trying to do air quality information for health. A lot of people are very focused on air quality information because they're trying to figure out like how bad air quality is in a particular location so that they either can create legislation or create laws, right? Whereas, that's fine if people want to do that, but I'm not focused on that. What I'm focused on is trying to change people's individual behavior based on what they're going to experience in the air they breathe today, right? What are they going to breathe in the air they breathe today? And what can they do to make sure that that's cleaner air rather than bad air, right? And so that's really the focal point. And it's hard to communicate that message. The technology, in some ways, it's harder and easier, right? We are making the advances we need in the technology, but how do you ultimately communicate this to your audience so that they understand the value? And they can translate that value and then take action that actually has the outcome you want them to have, which is less asthma attacks, less ER visits, a higher quality of life, all of these kinds of things. Because quite frankly, I think that's part of the challenge is people see every day people die of an asthma attack, and yet there's not this massive movement to say, hey, we can prevent asthma attacks that lead to death, right? And we can prevent it by not just the medications that are available, but by actually trying to prevent triggers, prevent them from experiencing these exposures, prevent them from experiencing allergens in the home. So I've partnered with various, like I said, what I call upstream interventions, allergen sprays, air purifiers. There's wearable air purifiers that are emerging that you kind of stick around your neck, and it kind of cleans the air you breathe as it comes into your vicinity of your mouth. So there's various things that are emerging that could help people prevent them from having symptoms, but we don't have enough information about that, and we're not communicating that enough to individuals on a personal level, so that they can prevent the asthma attack. I'm not opposed to people taking their medications. I want them to take their medications. We have automatic medication reminders in the app, right? So that they take their medications as part of their regimen. They should be doing that. Unfortunately, they're not in many cases because they don't have reminders or stuff like that. But in reality, in addition to taking your medications, you can reduce or avoid the impact of your pollutants and allergens that you breathe in every day if you take action. So that's really the goal.
Wonderful. So, tell us, how do you see apps like yours changing the way people think about healthcare in the future?
Well, I mean, again, I think what we've seen and what we're rapidly seeing is we're seeing that environmental determinants of health have a much greater impact on our health than we thought previously. And that is both on outdoor air quality, but that's even more so on indoor air quality. A lot of people are beginning to understand, like microplastics is something that's recently come up as a huge topic, is, the impacts of microplastics on our body, that we're consuming or that we're breathing or whatever, right? So that's example. The chemicals. I think that's one of the things that's been interesting recently. People have suddenly realized that part of the industrial economy is we built a lot of stuff, right? And what we learned in that process is we used a lot of different materials, a lot of different chemicals. There's byproducts of the things that we put in our homes that cause pollutants to be in our home, right? And we don't have a mechanism for cleaning that other than the traditional air filter, right? Okay. And in most people's homes, how many times do they change their air filter? If you're lucky, the traditional is, every 3 months you're supposed to change your air filter. Very few people do that on a 3-month regimen. So that's not having the desired effect of filtering bad air quality in your home, right? And that's why people ultimately buy an air purifier or something like that, right? So that's the thing is I operate from the premise of, unfortunately, when it comes to air pollution, I operate from the premise of it's going to get worse before it gets better. Okay. Um, I believe that we have the opportunity to change the way we, like, for example, gas guzzling cars, right? Will we transition to EV over time? Absolutely, we will. But it's not going to be overnight. It's certainly not going to be in the next 5 years. And so, in the meantime, we still have to deal with greenhouse gas emissions, right? And so, we have to figure out, how do we handle that? How do we experience that? I have come across even industrial air purifiers where there are these massive units they put by the highway. Yeah, and they kind of look unobtrusive because they look like they're stuck in between the trees and everything else, but they're actually big, huge industrial air purifiers sucking in air from around the road and pulling it into filters, industrial size filters, right, to clean the air in a city, or on the street. So these are the kinds of things that are potentially emerging, as ways of dealing with outdoor pollution, right? Outdoor air pollution, as well as the things that are emerging indoors. So, I like to use the analogy, like we're in the second game of a 7-game Stanley Cup series for hockey, or the second inning of a 9-inning baseball game, if you want to talk about baseball. But I mean, we're just very early stage in environmental health, right? And so I think we just have a great opportunity to, and that's kind of why I wanted to build the platform. One of the things that I feel like I'm in a unique position is I've been doing this for a while, but now, like I'm talking to a company about connecting to their wearable via Bluetooth, so that, if the person has that wearable air quality sensor, then the PM 2.5 or the ozone reading that comes through on the app, right, is directly from that wearable, right? And so I've got a conversation with them going on. I've got a conversation with the mobility company where we actually think there's a way to create what we call the health path, right? So the user would go to the map and they put their starting point, they put their ending point, and it would give them the healthiest route based on where the lowest thresholds of pollution are for them to walk or run or drive, right? And so we're talking to that company about that. So there's unique models that are going to inform people of best ways of dealing with bad air quality in their community, right? And that's where I think there's just a lot of opportunity.
That's wonderful. So tell us, what's one lesson that you've learned about building tech products that actually worked, or that actually helps people rather?
So lessons that I've learned. I mean, it's been a journey, and I would say that, the one thing that you have to feel comfortable with your developer. that you need to, realize that you need to be able to communicate with them and communicate what your needs are, and that they need to ask questions. Because a lot of times, what happens in that development framework is that you might tell somebody what you want them to do, but they're going to interpret without potentially asking, continuing questions, right? So, as you probably know, there's a waterfall approach, and then there's agile, right? And so, waterfall kind of is get all the requirements and somebody builds to it. Agile is a little bit more of what I'm describing is the developer has to be smart enough to look at the requirements and see what questions are there that they can ask to refine what needs to be done, right? That's one of the things that I think is challenging. I've come across the development scenarios where that wasn't done. It was more of a waterfall approach, and what you end up getting is as you get closer to release deadlines or things like that, you get to a point where you just have to deal with the waterfall approach that's been completed and kind of release that and then try to work from there. More often than not, the best approach to that is really this agile process, which is as you're actually trying to have your team develop, you're actually getting them to question and deal with it modularly. What questions you have around this particular section and stuff like that. So, yeah, again, I'm not a technical guy. Honestly, I have a political science degree, but this is a area of passion that I discovered, and so I've become. I think you saw. I claim I have 10,000 hours in environmental health, and so I consider myself more of an expert now, certainly than when I started. And so I think for me that the biggest challenge at times was really to wade into this technical component. I knew a lot about digital health and apps and EHRs, and I was exposed to technology. So I don't want to say that I didn't know technology very well. I definitely knew of the potential of technology, right, to solve this problem. But knowing that it can solve the problem and actually making it materialize is a much greater challenge than I certainly expected.
Great. So tell us, what's one piece of advice you would give to someone who wants to work on uh, tech that has a direct positive impact on human health and the environment?
Yeah, no, I mean, I think the piece of advice I would environmental science I think is a great area of opportunity right now. Like I said, I think that we are only beginning to discover the various ways that environmental exposures impact our health. I do think it's a growth area. Um, I was involved recently in something that called the Human Exposome Network, and I've gotten involved in that. And what their goal was similar to what they did with the human genome. They mapped the human genome. What they want to do with the exposome is figure out what are all the exposures, and there's probably like 6,000 different types of exposures. But the thing that I find interesting with that group is that we're trying to communicate to them, at the end of the day, you have to figure out, which ones are the most problematic for people, which ones are the most impactful on health. And then you have to figure out a way to bring that full life cycle to people to help them. But I think that my advice would be definitely you know focus on environmental science as an area of opportunity, certainly in high school and in college. I mean, I've seen high school students put together air purifiers, with box fans and stuff like that. There's lots of ideas that you can actually create your own little air quality sensor. It's very rudimentary, but you can do that as a science project. So there's various ways of kind of starting to get involved in the environmental science. And I think it's a great opportunity for young people that who again, are interested in science, technology, engineering, all of that kind of stuff. I mean, that's the beauty of this is it's not out of reach for us, to take environmental data and translate it, very quickly from sensor-based data into, actionable information. So I encourage people to definitely pursue it. I definitely think one of the areas is I'm looking to, potentially engage interns, college interns in the future, as I kind of expand the business.
Great. So, finally, I'd like to ask, what does innovation mean to you, and how does it relate to your field?
Yeah, no, I mean, innovation to me, I've been, it kind of goes back to this fundamental challenge right now, which is wearable sensors. I believe that wearable sensors are a great opportunity. And one of the things I've been trying to support is kind of the concept of hackathons, right? Where people come together as a group and we try to think about, okay, how do we create air quality sensors at a low form factor? And how do we accommodate, the ability for that wearable sensor to track multiple pollutants, in a way that's translatable, right? So that's kind of one of the things that I've just been trying to encourage is just more innovative um, effort in a particular area that could accelerate the growth of my industry, because I think that's where there's just not. Yeah, I think the data models and the AI and the machine learning are very, great. But what people don't seem to understand is that, when it comes to the environmental data, at the end of the day, you need sensors to track data. Now, the satellite observations that are going on from, NASA satellites or NOAA satellites, that's great, but that's again, that's very general information, not very granular information. And ultimately, where you're going to get the most relevant readings of air quality is at that granular level. So I think there's a lot of opportunity to just innovate in sensor developments, wearable sensors, and do that. That's kind of why I'm moving towards a model, even though I have the general data, through an API. I'm moving towards a model of connecting to the via Bluetooth, to the wearable, and then connecting via API to that much more granular mobile data. The challenge with the mobile data is that they're distributing that those sensors to cities, fleets that are in cities, postal service or Amazon trucks or taxis or Uber drivers or whatever. But they're going, city by city. And so, how do again, how do I accommodate that model from a city by city perspective? But, again, that's where the growth opportunity is. I would love to see, how do we embed a mobile sensor in the actual vehicle, right? The companies I've come across actually have a sensor that goes on top of the vehicle, but, is there a way that maybe we have a sensor that's part of the actual car or truck or SUV or whatever it is, right? So those are the ways that I think, we potentially can innovate. I think there's just a lot of innovation around, um, you know, uh, manufacturing, sensors at, that are much more lower form factor and price. I mean, again, the price of a current, like an Atmo tube right now, is I think $149. And that's a lot of money for a sensor to only tell you about two different, PM 2.5 and ozone, right?
Yeah.
Um, so I think that's where, there's opportunity to innovate. I mean, innovation, in my mind, is two things. One, something that's differentiated, but it's also something that potentially you can develop that is available to the largest amount of people, right? And so that's where the price comes in, right? Um, it's great if you innovate, but if the thing costs $5,000, then that might not be what is needed to innovate, to benefit people more broadly. So, but that's what I would say.
All right. So, finally, let us know, tell us, where can listeners reach you?
Yeah, you can reach me via email, eric@dailybreath.com. The app is available in both Apple app and Google Play stores. It's called Daily Breath, the air you breathe. And the website is www.dailybreath.com. And I also have a Substack, dailybreath.substack.com, where I have a lot of thought leadership that I've been discussing over the years. And so, I definitely welcome everybody to download the app, pay for the app, purchase one of those affiliate partners products if you'd like. And certainly I just want people to be very much advocates of understanding environmental health, and that it has an impact on their personal health, and they need to be more aware of the conditions outside, and so that they can take preventive action. Don't feel like you're at the mercy of the weather and the environment, right? You're not a passive player. You can go out there, you can be proactive, you can learn information that's going to change your behavior and hopefully protect your health.
Great. So Eric, it's been a wonderful conversation, and I'm really glad to have you on the Fairer Techcast today.
Well, thank you very much. I really appreciate this opportunity. And, I hope your audience appreciates the information.